Here at Lotte, we see somewhere between 30 and 80 patients a day. We do basic care for antenatal clinics. We do HIV testing and vaccinations for children. We also have just regular outpatients, kind of like a GP clinic, seeing everything from small cuts and flus and colds, but also malaria. Anything can come in the door. So we have maybe 1 or 2 blood pressure cuffs that actually work. We have 1 otoscope for checking ears and 2 stethoscopes. In the clinics in the bush, it's often worse. Sometimes they don't have a single blood pressure cuff, maybe 1 stethoscope. Some of the places in the bush have no beds. And other basic things, sheets, drapes for doing minor surgeries are non-existent. We don't have a sterilizer for sterilizing surgical equipment, so everything we use has to be transported into the main hospital in town and then brought back again at a later stage. So there's no way to do these things on site. During the day, we have no power, which means no fans. It means no light if it's overcast. We have no fridge to store the vaccinations. So whenever we have a vaccination clinic, the nurses have to transport from town, from the vaccine fridge in town. They have to collect the vaccines, they put them into a cooler, and then they wait for the bus to bring them to the clinic. At the end of the day, they do the same thing, but in reverse. In terms of medical supplies, there's a huge shortage of otoscopes, blood pressure cuffs, stethoscopes, IV stands. Most of the clinics don't have any form of sterilization, so usually they use pressure cookers, but even these don't exist anymore. We all need vaccine fridges, drapes and sheets, speculums for gynecological examinations, and for myself, I'd really like, if it's possible, a small but not too delicate microscope that we can take when we go to the bush for the patients who aren't able to come into town and who will be too long away from the hospital to be able to bring in a sample for pathology or for blood testing, and a book to help me as well, because just to look but have no knowledge is also not so useful. There's a lot of things that we need to help us improve the medical care here in Vanimo, but any little thing that you're able to help us with would be so much appreciated.